Let's continue our discussion on visual diagnosis, inspection. Still on body movements, now let's talk about tremor or spasticity of limbs. Tremor or spasticity of the limbs is a translation of the Chinese characters zhong, which means contraction or bending of the limbs, and zhong, meaning relaxation or stretching of the limbs. However, these two terms may indicate both spasticity and tremor of the limbs. Observation. The patient may suffer from contraction, relaxation, or tremor of the limbs. Tremor consists of shaking, trembling, or quivering of the arms or legs, or both. It ranges from a very pronounced shaking with wide amplitude to a quiver that is so fine and so narrow in amplitude, it is almost imperceptible. Tremor of the hand is more common than tremor of the legs. The cause is always liver wind, as with convulsions, it may be either the full or empty type. The former is characterized by a pronounced shaking of the limbs, and the latter by a fine tremor. The most common cause of tremor of the four limbs, especially in the elderly, is a combination of liver wind and phlegm affecting the channels and sinews. Liver-Yang rising by itself may also give rise to internal wind and tremors. Another common cause of tremors is liver wind deriving from liver blood deficiency. This is more common in women and will cause a fine tremor. Liver and kidney-yin deficiency are also a common cause of tremors in the elderly. In alcoholics, a fine tremor of the hands is caused by damp heat. In rare cases, retention of dampness in the muscles and sinews of the hand may cause a fine tremor of the hand. A general deficiency of qi and blood failing to nourish the sinews and muscles may cause a mild fine tremor of the limbs. Spasticity and tremor of the limbs may also appear at the blood level of the four levels, when the heat generated by the febrile disease either leads to liver wind or depletes the yin so that empty wind is generated. So to summarize, tremor of the limbs can be caused by phlegm, heat, and internal wind, by liver-yang rising generating liver wind, by liver blood deficiency giving rise to liver wind, by liver and kidney yin deficiency giving rise to liver wind or damp heat, as in the case of alcoholics. For its clinical significance, spasticity or tremor of the limbs may be due to many different patterns. Liver wind is the most likely pattern to cause this condition in its three possible manifestations. Full wind deriving from liver-yang rising or liver fire, empty wind deriving from liver blood or liver-yin deficiency, or wind combined with phlegm. In cases of full wind, the spasticity of or tremor of the limbs is pronounced, and the patient also suffers from pronounced vertigo. In cases of empty wind, the spasticity or tremor is mild, and the patient will display the symptoms of liver blood or liver-yin deficiency. When wind combines with phlegm, the patient will also suffer from numbness and heaviness of the limbs. The tongue is swollen and the pulse is wiry-slippery. Epilepsy is an example of a disease usually characterized by internal wind and phlegm. The same symptoms may be caused by a general deficiency of qi and blood, failing to nourish the sinews and muscles, in which case they are mild. Spasticity and tremor of the limbs may also appear at the blood level of the four levels, when the heat generated by the febrile disease either leads to liver wind or depletes the yin to such an extent that empty wind is generated. So here in liver wind, it will manifest with pronounced tremor of the limbs, severe dizziness, tinnitus, headache, numbness of the limbs, tics, stiff, deviated or moving tongue, and a wiry pulse. In wind phlegm, there will be tremors of the limbs, severe dizziness, blurred vision, numbness or tingling of the limbs, tinnitus, nausea, sputum in the throat, a feeling of oppression of the chest, stiff or deviated and swollen tongue, and a wiry and slippery pulse. Liver blood or yin deficiency leading to empty wind. There will be mild tremor of the limbs, slight tremor of the head, dizziness, blurred vision, numbness, and or tingling of a limb, and dry eyes. The tongue and pulse presentation depends on whether there is liver blood or liver-yin deficiency. In heat-generating wind, there will be tremors of the limbs, convulsions, twitching of the limbs, high fever, fainting, rigidity of the neck, opisthotonus, macular rash, eyeballs turning up, and clenching of teeth. There will be dark red tongue without coating, a wiry rapid pulse. This is an acute pattern that occurs during a febrile disease, and it corresponds to the blood level within the identification of patterns according to the 4 levels. So to summarize, tremor or spasticity of the limbs can be due to liver wind in full type, where there is severe spasticity or tremor with large amplitude, vertigo, and a wiry pulse. It could also be the empty type liver wind with mild spasticity or tremor with small amplitude, dizziness, and a fine wiry pulse. It could also be due to liver wind with phlegm, where there is numbness and heaviness of the limbs, a swollen tongue, and a wiry, slippery pulse. And it could also be due to qi and blood deficiency, where there is a mild spasticity or tremor of the limbs, tiredness, pale tongue, a weak or choppy pulse. So here we discuss further tremor of the legs. This could be due to liver blood or liver-yin deficiency leading to wind. This will manifest with tremors of the legs, numbness and tingling of the legs, of the limbs, dizziness, blurred vision, floaters, scanty menstruation, dry eyes, fine tremor of legs, tic, vertigo, tongue that is pale with coating or normal colored without coating, and a choppy or fine pulse. In kidney yin deficiency with internal wind, this will manifest with mild tremors of the legs, vertigo, dizziness, tinnitus, hardness of hearing, poor memory, night sweating, vertigo, dry mouth and throat at night, lower back ache, ache in bones, nocturnal emissions, constipation, dark scanty urine, infertility, premature ejaculation, tiredness, lassitude, depression, slight anxiety, a normal colored tongue without coating, and a floating empty pulse. A tremor of the limbs always indicates liver wind. We should then establish the source of liver wind and whether it is full or empty wind. The root cause of liver wind may be heat due to an acute febrile disease, liver fire, liver-yang rising, a deficiency of wind of the liver and or kidneys, and liver blood deficiency. The last 2 types of wind are of empty type, and all the others are of the full type. Full wind is characterized by pronounced tremors or convulsions during an acute febrile disease, whereas empty wind is characterized by fine tremors or tics. So to summarize, liver wind will have 2 general categories, that is full and empty. In full type, there will be pronounced tremors, convulsions, vertigo, unilateral numbness of a limb, and a wiry pulse. In an empty type, there will be fine tremors, tics, mild dizziness, tingling of limbs, choppy or fine and slightly wiry pulse. Here we have a case history of a 46-year-old man who had been suffering from a fine tremor of his right arm for 3 years. He had seen a neurologist who excluded the diagnosis of Parkinson's disease. This patient has very few other symptoms, complaining only of a feeling of heat in the head, cold hands and feet, floaters, an occasional itch in the left eye, and occasional heat and dryness in both eyes. His skin was also rather dry, and he had been suffering from myopia from the age of 8. His body type was a mixture of metal and wood, and his tongue was slightly thin, was red on the sides, and did not have sufficient coating in the center. His pulse was slightly wiry on the left and weak on the right, mostly on the lung position. For the diagnosis, the tremor of the arm is an unmistakable sign of liver wind, and we should establish the root pattern giving rise to wind. In this case, it is liver blood and Liver-Yin deficiency. The symptoms of liver blood deficiency are floaters, each of the left eye, dry skin, myopia from childhood, and weak pulse on the right. Dryness of the eyes and the lack of coating on the tongue indicate Liver-Yin deficiency. There are also some symptoms of Liver-Yang rising, where there is feeling of heat in the head and eyes, red sides of the tongue, and the liver chi stagnation, where there is cold hands and feet. The wiry pulse may be related to any of the full liver patterns. In liver disharmonies, it is not unusual to have a combination of several different patterns. There are no symptoms or signs corresponding to the weakness of the lung pulse, which is not unusual for this organ. When the lung pulse is the weakest of all the pulse positions, this is usually related to emotional problems due to sadness and grief. Here we have another case history of a 45-year-old woman who had been suffering from a fine tremor on the left arm for 1 year. She also experienced numbness and tingling of the left arm. She had a very few symptoms, except for her periods being quite scanty. Her tongue was pale and slightly thin, and her pulse was fine and wiry. The diagnosis: this is a clear example of empty wind deriving from blood deficiency. The blood deficiency is evident from the pale and thin tongue and fine pulse, and the wind is evident from the wiry pulse and obviously the tremor of the arm. Thank you for your attention.